nothing, it don't matter.
I'm gonna go ahead and let all our participants in.
No more, nothing even matters. Nothing even matters.
Now my fingers go and make it to the final floor. Just repossess my cause nothing even
Welcome, welcome. Those of you coming on in, good to see you. Thank you for being here.
Nothing even matters. Nothing even matters. Oh, oh, oh.
All right, welcome, welcome everyone. Bienvenidos. Welcome, Ashe. We are happy to have everyone in our square of Zoom. Thank you all for being here. We are gonna get started right away because we have a lot to unpack. So thank you for those of you that were in the waiting room. We saw you, we appreciate you being early and on time. We'll go ahead and dim the music down so you can all hear. Thank you, thank you. So welcome everyone and good evening. I'm sure some of you are multitasking as I learned that we have the president speaking at the same time as our workshop. So for those of you multitasking, I appreciate it. We love that you're here and you're participating. So thank you for the space. I'd love to welcome you on behalf of Evergreen Valley College and the Umoja Affirm program. We are ecstatic and super excited to have our first conversation with a partnership with Kaiser and the doctors from Kaiser that was brought to you by me and Dr. Armstrong. I want to first share a funny and story because the most important thing that I would love everyone to take away from this is no matter where you are in life, please share your thought, be open, and let's share with each other. That is what Dr. Armstrong did with me as his patient to my son. I am a new mom, and on my son's very first 2-month checkup with Dr. Armstrong, he asked me the most important question that you can ask a woman of color today, which is, how are you doing? And I want to know how you're feeling with all the things that is going on in our world today. That's all he asked me. And I broke down because I work for the Umoja Affirm program and told him all the pain and trauma that I was feeling and what I'm scared of with my son and my newborn, feeling with coming to the hospital and possibly having to do all these vaccines they keep telling me that I have to get. And now we have COVID. So he brought to light what a lot of my insecurities as a Black woman and many of us have as people of color, that this is a conversation we should definitely have and open up to public. So I want to thank you, Dr. Armstrong, for pushing forward with me and helping me gather the other doctors that you brought forward to be a part of this panel today, and also connecting me to Dr. Akila Carter at San Jose State to help really show the history and the light of some of the things that we are dealing with as people of color. So thank you. Thank you to everyone that is part of this panel and the partnership that we have now built. I appreciate the work that we are putting forward. So a little bit about the Umoja Affirm program. We are an academic program at Evergreen Valley College, and our program services African-American students to make sure that they are successful and have a support system during their time at Evergreen Valley College. So the word Umoja is a Swahili word, which means unity. And I like to start that off by just simply letting you know that this is a unified zone. Although we are in the spirit of Zoom and on a digital platform, we ask that you are here, you're present with us, and that in itself is the unity that we are looking for. We are looking to educate our community. Our community is just not our students, but our students' families, our students' coworkers, our neighbors, and anyone here that is joining this meeting. You are now part of the Umoja community. So we welcome you, we say Ashe, Bienvenidos, and we are happy to continue the work with you. So please be mindful that the chat is live and we are recording as well. So there are a few ground rules. You will all be muted so that we can get started on the conversation. We do have a presentation. And then towards the end, after the doctors have answered the beginning questions, the floor will be open for the public to ask their questions. So if questions come up while we are in conversation, we ask that you put it in the chat as we are monitoring the chat. You can always raise your hand and we will do our best to try to keep track of whose hands is raised first so that we can call on you when the time is open for open conversation and questions. What other ground rules do we have? I think that's it. So to get moving along, I do want to mention that Evergreen Valley College, we have taken a lot of pride in this workshop, especially because one of our STEM programs being health, and we have a wonderful nursing department that has dedicated to educate future nurses in the work field with the commitment to being culturally aware, and how do we train our nurses and train our students to have the ability to be sensitive to different cultures. So this workshop is definitely framed around our training, and the department has made the commitment to always include that into their curriculum, because not only are you servicing people that might look like you, but you're servicing everyone. So we have to be able to talk and communicate and understand the perspective from other cultures and customs so that we are given the space for them to express themselves, which is an example of what Dr. Armstrong did for me and my son, which we are so grateful. So moving forward with our agenda, as I said, we're gonna first have a presentation. And this presentation is going to be from Dr. Akilah Carter-Francique. Just a little background about her. She graduated from the University of Georgia with her PhD, and she currently is the executive director of the Institution for the Study of Sports, Society, and Social Change at San Jose State University. She is also the associate professor of San Jose State University Department of African American Studies. And she will be giving us a brief overview of the challenges and a little bit of our trauma as people of color have faced in the US today with the relationship of medicine, healthcare, and what it has done to our people to get us to question things and question why we are here. I do want to also mention that by no means are we here to persuade you, force you, or encourage you. We are simply here to educate you to then go out and educate the community. And please get in contact with us if anything here is confusing, misleading, or you just need more information. We have full connections with all the doctors you are going to hear from for today. So we ask you to keep that in mind and be open and ready to hear from all of them. So without further ado, please give a warm Zoom welcome with emojis, finger signals, smiles, anything you got to Dr. Akilah Carter-Francique.
Good evening, everybody. Oh my gosh, what a day, what a week. I'm just trying to figure out where I'm at right now. It was one long day, it really feels like. But no, thank you definitely, Claudia, for having me here today. The opportunity to speak and share the work that we do at San Jose State University for the Institute for the Study of Sports, Society, and Social Change with regards to all of this. And so glad to be here. Have to give a shout out to Dr. Armstrong, who is also my children's physician and connected me as well. I think we had a longer visit with me than we did with the kids, but it was great because he really took the time, as Claudia said, to get to know me, see how I was doing and managing all of this, because it is truly a lot of things to definitely manage. Are you all able to see my screen? No, let me try this here. There we go.
Yes, you're good.
Good. So got a few minutes. Let me just to spend with you, also take you on this quick little journey with me. Okay. So feel free to connect with the Institute at following our website as well as our social media platforms and see the good work that we're doing. And we can talk more about that later, but just wanted to flash that up on the screen for a quick second. So I bring to you this presentation, Ease My Troubling Mind. Do vaccines really protect your community? I started off with this title. I have a sound clip here. I'm not going to play it this evening, but I want you to think up and look up Sam Cooke. And he talks about this notion of ease my troubling mind. Help me do that. And so through this presentation today, I hope to create a pathway to sort of ease your troubling mind. And so what I really wanted to discuss was the role of equity and social justice in the context of sport, illuminate how COVID-19 and Black Lives Matter influences Black athlete participation, and discuss thirdly, how vaccines, policies, and mandates affect Black athletes, their families, and the community. And you may be saying to yourself, why does sport matter? Why is sport something of importance? When I talk about the Institute, I want you to know that, again, it was founded in 2017, but it was a brainchild of Dr. Harry Edwards, who was the architect of the Olympic Project for Human Rights. And through that project, he was able to inspire Tommie Smith, John Carlos, to stand atop a podium and speak up and speak out with regards to the social inequities that were happening in the US on a global platform. Through his organization, he not only inspired them, but he inspired a host of other individual athletes and teams, not only in the US, but definitely abroad, and even for generations to today. And so we can see the effects of his work and his platform through different readings. If you check out The Revolt of the Black Athlete, Silent Gesture by Tommie Smith, or the John Carlos story, or if you, like me, got your recent box of Wheaties, you can learn about Tommie Smith on that as well. So when we talk about COVID-19 and Black Lives Matter, this notion of the Black athlete participation, I really want to talk about this because hopefully you saw, as I saw, over the past year, and in the early months of the onset of COVID, and then after the murder, right, of George Floyd, the efforts of athletes to be pushed out to the fore to play, to participate for our own edification and entertainment. But through that, those athletes use their platforms to promote social change with the Black Lives Matter, standing up for I Can't Breathe, or even taking the time to say, hey, we're not playing until our league begins to address some of these issues. We saw athletes like Naomi Osaka use her platform with the 7 different face masks to call out the names of George Floyd, Ahmaud Arbery, Trayvon Martin, Breonna Taylor, right? And we saw the individual passion by our dear student athletes. And I have 2 of them here that actually work with me, Caleb Simmons, as well as Natasha Harris, that each of them set out on their own path to use their platform to stand up and to speak up for social change. Natasha Harris worked with some other athletes to raise $1,000 for the Black Lives Matter movement. And within 1 week, raised $78,000 using her platform. Caleb Simmons is still continuing to use his platform, and we have shared the stage and spoke to many groups about his efforts as an athlete to speak up and speak out about these issues of social inequities, even to the point that he works with the African American Community Service Agency to hand out PPE during this time of COVID. So as we begin to unpack the history and systemic racism, one of the things that I want individuals to know is that when we talk about professional athletes, when we talk about college athletes, the reason why they are centered is that we went through a host of challenges. When we think about the NBA athletes in particular, they went into the bubble, right? They had to leave their families, their friends, their loved ones, their children, and really, kind of sacrifice themselves and their health without being vaccinated for the play of the game. I'm not going to say the love of the game, but I'm going to say to play the game when we talk about the economic dollar. Our college athletes had to face the challenges of going back to class face-to-face, to opt to return to play or to opt out. They also had to deal with this notion of coping with the death toll realities of COVID-19 and the at-risk realities of being a part of the Black community. because we were seeing a push and a keen push for our student athletes that were in revenue producing sports to put their lives on the line to play. What did that mean? They had to weigh the options of being a caregiver to a parent, to a sibling, to another loved one. Some of them were also at-risk populations. I myself am asthmatic, so some of them were asthmatic. Some of them also had sickle cell, okay? And so they were asked to sort of put themselves and sort of weigh that. And last but not least, and I think something that we're all dealing with, these athletes also had to manage the stressors of managing their mental health and wellness. So we begin to unpack this notion of the history of systemic racism. It did affect these athletes because guess what? They are part of the community. They are us. We are them. So we saw COVID-19, the racial unrest in Black Lives Matter, sport participation, all come together, coalesce in this space and time during these dual pandemics. What it began to elevate was and illuminate were the deficiencies that were happening and the barriers and hesitancy when we talk about the Black community. Why? Because many of them had lived experiences and historical treatment of negative historical treatment when we talk about their engagement with the medical community. We saw this notion of racial myths being rooted in sort of this biological rationale of racial categorization take place and become illuminated again. Also issues of where they lived, what their education was, did they have health insurance and coverage, what their daily income was, and other social inequities began to illuminate during this time period of COVID-19. And also the notion of mistrust and misinformation. So we began to hear remnants of the Tuskegee experiment, of even Henrietta Lacks, and how all of those things began to play a role in the trust or mistrust of the medical community, and things that really, and it's another conversation for your physicians here, to talk about this notion of medical ethics and abuses. I take that a step further because again, when I talked about neighborhood education, health insurance, and income, these all situated in this notion of social determinants of health. Where you live makes a difference, right? Your income and the fact that you have a job or lost your job during the COVID times makes a difference. We're still seeing issues of segregated hospitals in our communities, or hospitals that are far away and are not covering the care that we need, providing the care that we need, and issues of cultural competence even coming into play. And so those are some of those things that begin to rise to the fore when we talked about issues of challenges when we're talking about COVID-19 testing and vaccinations. And so then I bring you the case of Henrietta Lacks. I think many of us are familiar with the Tuskegee experiment, but I wanted to bring this to the fore and help us understand that some of the issues that are coming out with with Tuskegee as well as Henrietta and a host of other historical challenges were this use of not being able to communicate, or they did not communicate and sort of be forthright and transparent in their daily treatment and how they were communicating with these individuals. But we begin to learn and unveil a lot of the history when we talk about the case of Henrietta Lacks, and she's often deemed as the mother of medicine, and her role in sort of serving as a greater purpose when we talk about the HeLa cells. Again, I'm not going to get into a lot of history of that, but to know that her story and many others that are outlined in the work of Harriet Washington and medical apartheid begin to unpack some of the reasons and rationale behind our own community. I think of my grandmother who's 96. She's seen a lot. She's lived through so much, and how these things began to weigh against her willingness to obtain a vaccine, to go to the doctor, to even just seek additional information. Obviously, things of race begin to serve as a factor. Generational issues begin to serve as a factor, as well as our daily societal issues of inequity that begin to, again, creep up in many different ways. Again, when we're talking about schooling, when we're talking about where we live in our neighborhood and what we have access and opportunity for. But to know too, within all of this that happened, that we have also within us a community of resistance. And throughout time, there have been various individuals, groups that have also served to create safe spaces and to create advocacy and activist efforts to promote change and support for our community. We look as early as 1895 with the National Medical Association, with Black physicians creating their own space, safe space, because the American Medical Association was one that was just very segregated and didn't allow Blacks to participate. We look at the incomparable Booker T. Washington creating a National Negro Health Week. We look at the work of the Black Panther Party, creating medical clinics and breakfast programs, as well as some Black citizens in Pittsburgh that created the Freedom House ambulance service. So we are here, and we are a community of activists and advocacy individuals that are working with our communities to ensure that they can receive the benefits of all. Those advocacy efforts still continue today. If we look at our local, regional, and national efforts, we see a lot of that taking place. As I mentioned earlier, the African American Community Service Agency in our own local region is doing great work to provide space for conversations, for education, and for resources should you need it. Johns Hopkins University, the Medical Institute, is also continuing the work when we talk about promoting the education of Henrietta Lacks. So I encourage you to go to that particular website and learn more about the work that they're doing there to begin to, again, many ways, right some wrongs and provide some funding and support for students of color. At our national level, the Centers for Disease Control, the Office of Minority Health, the National Association for the Advancement of Colored People, also known as the NAACP, as well as this very point, as Claudia talked about tonight, President Joe Biden is creating forums for conversation to take place, for education to take place. So if you have questions, I highly encourage you to seek out these offices, these agencies, institutes that are doing this work to learn more about issues of health, wellness, and beyond, and as well as the great panel that we have here today. And last but not least, I want to bring us back to sport and this notion of sport, to know that our athletes, while they may have been centered and placed in a position of a compromise, of having to weigh the odds of what do I do, to know that they continue to move forward, continue to use their platform to promote social change, just as Anquan Boldin here, NFL wide receiver, Florida State University graduate, worked with his community in Pahokee, Florida, to provide access to COVID-19 vaccinations in his hometown community, because he realized in this hometown community, a rural community, they did not have access to the public grocery stores. Publix, again, is their grocery store chain in Florida, to get the COVID-19 vaccination. So created a pathway to support, to help, and to serve. So again, with our Institute, we continue to promote these conversations, and I'm glad to be a part of this conversation today. We do so with our platform called Sport Conversations for Change. And in that, we talk about the notion of illuminating organizational deficiencies and inequities. We talk about the benefit of learning from industry leaders, as you are here today, experts and advocates in the field, but also bringing a culturally relevant conversation to also talk about the importance of cultural competence in our educative dialogue that we have. But ultimately, as particularly as it pertains to this conversation today, there is a need to work with the community medical professionals that serve the greater body. And so I am also not only a patient of Dr. Armstrong, but I'm also working with Kaiser Permanente on their Parent Advisory Council. So if you have questions, if you feel a need, use your own platform, get involved to begin to create these conversations, to raise these issues, and really to promote change. So with that said, I say thank you, and I look forward to hearing from our professionals and our medical physicians today. Please again, tune in to things that we have going on at the Institute as we continue to push our agenda when we talk about words to action, and you can find me here. Thank you so much.
Thank you, Dr. Akilah. Please give me a finger, spirit fingers, snaps in the air, whatever you got. We welcome that. Thank you, Ashe. That knowledge was so powerful and exactly where we are standing as a community. So thank you for bringing that to the forefront. She hit a lot of points that I'm sure some of you we have lots of different generations on here. You might hear things here and there. And then we always, what do? Run to Google. Then we start researching on our own and trying to find, what does that mean? When did this happen? You are getting swamped with information, and it might be confusing at times when you're hearing from so many different people and so many different resources. Please, 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 the key thing she said was talk to someone, ask questions. It's your right. It is your right. All your research, bring it to your doctors. If you have questions on any vaccines out there, any confusion on any medicine, anything dealing with your health, your children's health, your family's health, ask your doctor. Bring your research to them and have a conversation. It is your right. So thank you for setting the stage to let the community know and us in this space know how people of color are feeling, the fears that we're having. What are some of the trauma that our ancestors faced, to where today confuses things when the government says our Black and brown communities are most affected and we need everyone to line up and get vaccinated. Or when you're a new mom like me and you show up and the hospital says you're here for your vaccine shots for your son, and you say, wait, hold on, he's only 2 months. What are all these shots? What's in them? We just have questions. So I'm glad that we are able to have this conversation. I'd like to let the doctors introduce themselves to you before we get into the conversation. So doctors, if you can unmute yourself, if our assistant there can help, our ambassador, please help them unmute themselves. If you could just give us your background, a little bit about your area, what you specialize in, and the best fun fact about you. Dr. Armstrong, I'll let you start.
Oh, well, first of all, I am just honored and I guess overwhelmed to be here. You know, you look at me, I'm a white guy, I'm a privileged white guy in your community, with your community now. And I have to tell you, this is new for me. I am an infant in this kind of work. And what happened was very similar to what Claudia said. You know, she came and she listened and something came up. Well, kind of the reverse thing happened for me. I had the opportunity to work with a couple of people. One was Sydney Spears, who's an African-American psychologist and professor. I did a workshop that she was leading. She's from the University of Kansas. And then at that same workshop, I heard a professor, his name's Biko Gray from Syracuse. Some of you may have heard of him. And they allowed themselves to be vulnerable about what they've gone through in life as African Americans growing up in this country. And after hearing them, it was like a door opened. I could not go on not facing the issues that we face in this country for racism. And I made a commitment to start talking to my patients and opening that door. And I haven't looked back. And it's primarily, I do this for myself. Because what happens is I hear what people go through and it makes me a better physician. And so that's why I'm here. I'm here, you know, I'm here to do whatever I can to make this a better world that we live in and make this country a better place. And we can only start with ourselves. So I'm here to learn from you guys. I'm here to learn from the other doctors. I've already heard from Dr. Akila and learned from her, and I learned from you, Claudia. So I'm a pediatrician. We work with a lot of vaccines. I will be giving some information on that, but I'm really here to learn from others. Thank you.
Thank you, Dr. Armstrong. Now, before I start with the next beautiful, lovely ladies of doctors that we have, I must say that Dr. Armstrong, without you, I would have been walking blind at Kaiser and asking so many questions because I wanted Black doctors. And that is something, as a Black woman, we often look for someone that looks like us, that represents us, because the conversation is different, as you mentioned. So when you introduced me to these lovely ladies, my heart jumped for joy, not only because these are Black women that are doctors, but they were all in San Jose at Kaiser, and I had no clue. And as a woman that's in San Jose, I'm always looking for Black professional doctors for my children to have someone to look up to talk to. And as we know, our culture is a lot different when we could talk to someone that resembles us. So that representation, and what you did to make sure that I was connected to the Black network of doctors is truthfully, I'm grateful. And I hope that we can continue to spread that, because San Jose's Black community, although we're here, if you don't know us, you won't see us. And so I thank you for making this connection. So the next doctor I'd like to be introduced is the doctor that helped start my labor, which is Dr. Little Richardson.
Hi, good evening. Thank you for inviting me. This has been, really interesting so far. I never really thought about a connection between sports and our experience as Black individuals in this world, but obviously there's a connection. So that was really, really interesting. So I'm an OBGYN. I'm recently moved here from New York. So, like Claudia mentioned, if you don't know, you don't feel like you see other Black people. So I'm, eager to get to know more of our community here in San Jose. And I work at Kaiser currently. And then interesting fact about me, I was in a documentary, like my last year of residency, called Lenox Hill, which is on Netflix, which you can check out if you want to or not, but you can see my own delivery. So that's a little fact about me.
Thank you. Yes, she's famous, people, so check her out. And our next doctor, Dr. Graves.
So I'm Shukala Garvey, and I'm a family physician. I'm so glad to be here. This is awesome to be a part of. Really looking forward to this. A fun fact, I don't know, I was born in Akron, so a home of LeBron James.
Hey, okay, MVP. Good fact. And our last doctor in our panel, Dr. Weaver.
Hey everyone, I'm Dr. Candace Weaver. Let's see, I'm very, very happy to talk to you all. I'm a family medicine physician. I went to school at UC Berkeley, so I'm actually from Los Angeles, but I'm educated in the Bay. I did my grad school at Johns Hopkins University, as well as Dartmouth, where I received my master's in public health, emphasizing in epidemiology. And I am trained in residency here in family medicine in the Bay Area. So that's where I practice. I practice here in Gilroy. And I'm happy to, be here and answer questions for you all. I too, before I'm a physician, I'm a Black woman and I'm a Black mother. And I have many of the same concerns that you all have. And I try to advise my patients of all races, but especially my patients of color, the same way that I would advise anyone in my family or any of my friends. So I encourage you to seek out a doctor that you trust, regardless of if they're African American, and find good evidence-based information, and we're all happy to provide it for you. That being said, I don't really have that many interesting things about myself other than I like to bake. And I too have been on a few TV shows for baking.
Hey, look at that. We got famous doctors in the house. All right. Thank you for sharing. Okay, so we're going to get into the heart of this workshop, which is this real conversation. And when I say real, that's your Moja style. We want to hear the real nitty gritty, what it is. And again, while we're talking, if a question comes up, please use the chat box to write your question so we can make sure that it is heard. we formulated a few questions just to get the conversation started. And these questions came together from the Umoja Affirm Committee at Evergreen Valley College. This committee is made up of staff members, faculty, administrators, as well as classified members and students of Evergreen Valley College. So we came together and put a couple questions just to get us started. But if things come up, we ask you please use the chat. There is no question that is not worth being answered. So please use the chat. We do want to hear from you and be able to get to your question. So the first question we are going to let all the doctors address shortly. I ask that you try to keep your answers to at the max 2 minutes, minimum 1 minute is fine, just so that we do get through the 8 questions that we have, and then still allow time for the audience to ask their questions as needed. So our first question is, as we just heard from Dr. Akila, now knowing, the idea of medicine in America has an ugly past with African Americans. How do we trust that vaccines will keep us alive and not kill or affect our health down the line? So we can start in order of introductions. Dr. Armstrong?
Yeah, so it does have an ugly past, and unfortunately, it still has a lot of issues. I just heard a story from about an African-American doctor who was in training who had a patient who didn't want her because she was Black. She did not want to be cared by a Black doctor. And the attending doctor with her said nothing. This was not too long ago. We still have a long ways to go in this country. We just do. And thank goodness we're have the opportunity to open up around this in such forums as this. And I only hope that all of us as individuals continue to speak out and speak up about things like this. Now we know that the brown and Black community have been hit very, very hard by COVID. And part of that is because of our racist past in our country. However, the COVID vaccine is one way to prevent getting very sick or dying. That's my understanding. And my understanding too is that the vaccine, actually, one of the top scientists is an African-American. Her name is Kizzmekia Corbett, Dr. Kizzmekia Corbett with the NIH. And try and look her up and listen to what she has to say. Thank you.
Thank you. Dr. Little Richardson? Oh, you're muted. One moment.
Okay, so how we, can trust the vaccine. I mean, I'm an OB, so, a lot of our history of how, procedures came to be in terms of delivery, just how the speculum that we use for regular pap smears is based in, the brutalization of Black women during slavery. So I'm very familiar with our really torrid past. I think that how we trust this vaccine is that we do exactly what we're doing now, where you do your own research, you ask your questions, look up the answers. And I think that, and historically, how slavery works is by, kind of beating you down mentally and physically and making you feel inferior, that your questions are not worthy of answering. And so we are resetting that model by coming to forums like this. And so I think, number one, just like Claudia said at the introduction, you are in charge of your body and you have autonomy. So at the end, you make your own personal decision. And our goal is just to help you make that decision based on real facts versus Facebook, which has a lot of false facts, which we all know. And I think that's how we learn to trust the vaccine.
Thank you. We'll take one more. Dr. Weaver? Would you be able to answer that?
Sure. I mean, everything that I would have said it sounds like it's already been said. I would like to piggyback on that. The vaccine was created in large part by a Black woman. Dr. Corbett is an amazing genius. And I think that is not well publicized enough. I can also say that, first and foremost, we do need to acknowledge the horrific history of how African American people have been treated by the medical establishment for many, many, many years. What I can say is that Tuskegee was so many years ago. We have learned from that, that atrocious study. We have now introduced so many measures in place to make sure that we are represented in trials, that the trials are not cutting corners, and that the vaccines are safe for African American people. I again encourage everyone to make sure that you're getting your information from trusted sources, from reliable sources. Make sure that if you hear something that says a study said, what study said it? Was it published by a peer-reviewed journal? Was it by a reputable source? Was it, or is it a link on Facebook or somebody, making something up that doesn't make any sense scientifically? So find someone that you trust, find a physician that you trust, and get information directly from them. And I think that's the best way that you can know if it's trustworthy or not.
Thank you. You've already put a lot of things in my head. I did not know that the vaccine was created by a Black woman. So I am very intrigued. Dr. Grace, I don't want to forget you. So could you please answer the first question?
Yeah. So I would also agree with everything that everyone said. But another thing that people don't know about is Dr. James Hildreth, the president of Meharry Medical Center. He serves on the FDA committee that authorized the emergency use of these vaccines, and he's a Black scientist. So I think representation definitely matters. So if you have people that look like you, that have been in every step of the way regarding the COVID vaccination, I think that definitely helps build trust.
Thank you. Okay, second question. This would be for Dr. Armstrong. Why are children not given the COVID-19 vaccine? If it can protect adults, what is the difference in children? Go ahead and unmute yourself.
I'll just add on to that last discussion. I have to say, when I go to make a decision for my body, I will often check multiple sources. That way I feel more comfortable. So, but the question is, you're asking, why isn't the COVID-19 vaccine given to children? Basically, well, one thing is that vaccines and medicines, children are always the last to kind of get those. They're usually tested on older people. Children are seen as vulnerable, and they are. And so that's one reason. But the other reason is children are not as susceptible to COVID. For some reason, they have in their respiratory system the receptor for the COVID virus, that spike protein that attaches to the respiratory system. Their children don't have that. And for that reason, they don't get the infection as frequently, and they don't get as sick. So the vaccine has really been focused on the elder and older population, those people at risk, which we know have more hospitalizations and deaths. So that's basically why we haven't given it. However, you've probably seen in the news, there are children who have died. There's about 600 children who have died. There's also this multi-system inflammatory deal that happens in children where their platelets may go low and they may get high fevers 2 weeks after COVID. There's been many cases of that, and that's been in the press. So children do suffer, the numbers are not as great. And I'll tell you that we are looking, or the scientific community is looking at bringing it to children. It's already down to 16. 16-year-old kids are getting the vaccine. By June or the end of May, it may be down to 12. And before September, they're doing the studies now, it may be down to school age. So that is on the horizon. And thanks for the question.
Thank you. Just real quickly, we do see the questions coming in. Please keep them coming in. And also, if you haven't signed in, please make sure you do sign in. That is how we can keep in touch with you and also connect you with more information following this discussion. So please make sure you do sign in on the chat. Next question is for Dr. Richardson. Is there a possibility that there could be a long-term side effect that we do not know about yet as studies continue?
Yes. So I think in order to answer that question, we have to understand how the vaccine works, which I know I did see as a question. So this vaccine is new, and that typically our previous vaccines was giving you an old version of a disease in your body, building an immune response to a weakened version of the virus. That's the traditional flu vaccine. So it's either dead or it's a weak live version. So this is completely different. This is your body. The vaccine is giving your body a signal or a message that then your body sees this message and then creates memory to fight the vaccine without you ever having been exposed to the vaccine directly. So I think the easiest way to understand how that works is an analogy I thought of myself when I was just reading and learning more about the vaccine is it's like getting a message, a postcard. It's a messenger from the postmail. So you get a message, you get a letter that says, hey, there's a tornado coming. You should prepare for the tornado. So when you get an email or you get a letter like that, you say, okay, let me prepare my house for this tornado that's coming in 2 weeks. You prepare a house, and then what do you usually do? You throw away the letter because you don't need it anymore. In the same sense, that's how the vaccine, the COVID vaccine works. Your body gets a message, it's through this messenger RNA vaccine. Your body reads the message, it got the information, it's destroyed, meaning it's degraded. The vaccine does not integrate with our DNA. I saw that was another question, because that's not how RNA or the mRNA process works. So it does not become part of our cells, does not enter the nucleus, the brain, or the heart. It reads the message, throws away the message, and then that's how we get immunity from the vaccine. So then thinking about, are there long-term effects? So I can never say never, right? I don't know the future. Science is always changing. Based on how we understand the vaccine to work, it doesn't seem that there would be long-term effects because, again, the mRNA, the message doesn't stick around. It's destroyed by the cell. So I wouldn't imagine that the vaccine would have long-term effects, but maybe how your body remembers or builds immunity to the COVID vaccine later. But there's no studies so far showing that. So I can't say never, but just based on how we understand the vaccine works, unlikely.
Thank you. I'm going to jump to Dr. Graves. Your question, since there are different strands of COVID-19, are there discussions about the vaccine being administered annually, similar to the flu?
So the jury is actually still out on this. So the CDC hasn't come with any guidelines regarding an annual vaccine. The good thing, though, is that the vaccines that we have now do show evidence of being helpful in regards to the variants. So hopefully soon we'll know more, but as of right now, nothing as of yet.
Thank you. Dr. Weaver, we're going to jump to your question. How do you know if you're taking too much medicine? For example, if your doctor prescribes you medication for 7 days and in 4 days you feel much better, should you stop taking the medicine at that point?
So that's an interesting question because it really depends on an individual's health in general, and also depends on what medication they're taking and for what reason. But that being said, in general, I would always recommend taking your medication as it is prescribed. So one example of when this often comes up is when someone is on an antibiotic. Antibiotics are prescribed for bacterial infections only, not for viruses. So for instance, COVID cannot be cured or helped with an antibiotic necessarily. And there's no antibiotic that can make a virus or a cold or something like that go away. But oftentimes someone will start taking an antibiotic and it starts doing its job, and then they feel better and then they stop taking it. But the problem with that is that it can do two things. It can undertreat your infection. And so the only bugs that are left are the strongest, and then they replicate and you have a very, very bad infection that can't be treated with the typical antibiotics. And then also when you're not taking your antibiotics as prescribed, and you're saving them for later, and you're doing little things with your antibiotics instead of taking them for the entire course, it can lead to other things like drug resistance down the line. So just be careful. In terms of other medications that you take, I would always check in with your doctor to see if it's appropriate to discontinue the medication if you're feeling better. It really just depends on your illness and why the medication was prescribed and what medication was prescribed.
Thank you. Again, if you haven't signed in, please do so in the chat. Our student ambassadors also putting links in the chat to different resources that the doctors prescribed to us prior to the workshop, so that you can get more information on things that are being discussed today. So please keep your eyes on the chat as well. Dr. Armstrong, we're going to jump back to you. The question is, what are the ingredients in vaccines? And why are some cause allergies or reactions to them? So for example, what could you find in the MMR vaccine or hepatitis, chickenpox, now COVID? What are the actual ingredients in there?
So I'm going to answer specifically with regard to the COVID vaccine, if that's okay. And the mRNA vaccines are what we're using at our facilities in Kaiser. That's the Moderna and the Pfizer. So obviously there's the mRNA that Dr. Little Richardson already described what it does. There's something called lipids, which are fats. That's part of another ingredient. There are salts and something called amines. The salts are like a buffer because when you put something in the body, we have to keep it in the same kind of milieu or state, or kind of, we can't put anything that's very, very different from the body's solutions and salts. So we try and mimic that in the vaccine so it doesn't throw our body off. There's something called, there's sugars also. One is called polyethylene glycol. And there have been, so that's basically it. And these vaccines, especially the Pfizer vaccine, is kept at an extremely low temperature. And that's one of the reasons there aren't more additives. So I think it's important too to focus on what is not in the vaccine. There are no animal products in these vaccines. There are no antibiotics in the vaccines. There are no blood products in the vaccines. There's no DNA, no egg protein, no fetal material, no gluten, no microchips, no pork products, another animal product. There is no thimerosal, which is related to mercury, which used to be in vaccines. It's not in there. And there's no soy. So I think it's important to look at both things. The other question is, are there side effects? There are side effects, many side effects, but most people do okay with these. So headache, sore muscles, sore throat, fever, those are the common ones. My wife had hives with hers. Another friend of mine had hives. So a rash. And there have been a few people with really strong allergies to the vaccine. It's not been enough to stop the program, although with the Johnson & Johnson, there were some people with blood clots, and that did stop them giving it for a time. That has now resumed though. So there are some side effects, and we have to keep our eyes open all the time. That's why I'm not convinced right now that children should get the vaccine. Let's look at the studies first. Thank you.
Thank you. We're going to jump to Dr. Richardson. The question is, when do we expect the COVID vaccine to be fully approved from the FDA and not just emergency use?
Okay, excellent question. So again, I like to give background. So what is the emergency use authorization, EUA? And how does that process work, and how does it differ from the fully accredited? So emergency use is when you have essentially a pandemic, an emergency situation that the United States has deemed, that the health of the public is in extreme danger. When you have that, then they basically give you an expedited process because there's no equivalent treatment available, because the idea is that more people are going to die without having any options available. So what does that mean versus the fully accredited? So efficacy or the effectiveness has to be equivalent. So there's no compromising on the effectiveness of the medicine. So it still has to go through phase 1, phase 2, phase 3, which is kind of the different populations that the vaccine or medicine is tested on before it's available to the public. The main difference is actually in the time frame of observation after the medicine or the vaccine is administered. So for example, an emergency use authorization, you need 3 months of observation before it can become accredited for EUA. So that's what each of these vaccine different types had to go through. The typical official process is 6 months of observation after. So they essentially cut the 3 months difference. So in terms of it has to have equal efficacy, so that it's not a change in whether the medicine works, but it's a change in the side effects or observation of the side effects. So it goes from a 3-month observation to 6 months observation. And that's really the main difference. It's just the time of observation afterward. And I did see a chat question asking, why is the COVID vaccine able to be developed so quickly, but we have things like cancer that have been around for so long and we've had no treatment. So part of it is political, right? Some diseases affect populations that frankly people don't care about. Usually us, people of color, in developing countries, there's bacterial infections that we probably can create an antibiotic for, right? But you don't have funding. So what's the difference is that when COVID came out, it affected such a large percentage of the world that billions of dollars were thrown at it, that typically labs are grabbing to get money every year. They're applying for so many grants so they can do research for a few months. All of a sudden they're flooded with money. So then they have the opportunity to work on studies they've been working on all along. So they've been developing this mRNA vaccine for coronavirus, not specifically to COVID-19, but other coronaviruses, that they're able to basically amplify that process because the base was already there. So it's really money and desire about a disease that people care about. So cancer is also very difficult. There's so many cancers, they affect the body differently, but it probably has a slightly political origin. So I guess in this sense, we're a little bit lucky that there's money for COVID.
Thank you. Thank you so much. So our last question from the committee itself is going to be answered by Dr. Gravy. The question is, since the vaccines given for COVID-19 are investigational drugs and its safety and efficacy have not been established, there are many that are not planning to take the vaccine. What are some measures one can take to build up their immune system to combat sickness and diseases such as COVID-19?
Okay, so the biggest thing you can actually do is what we've been telling people all along, which is making sure that you're wearing a mask, maintaining social distancing, practicing good hand hygiene, avoiding crowded indoor spaces, surface cleaning and disinfecting, all those things. And then another side is making sure that if you have a chronic disease like diabetes or high blood pressure, making sure that it's well controlled. So that's very important. Another thing is just making sure that you're eating healthy, you're exercising, getting enough sleep, things like that.
Thank you. So just to clarify, there is no magic juice, no best fruit that we can take?
Unfortunately not.
Okay, so safety measures, if you are choosing not to get vaccinated, keep social distance, keep wearing your mask, and continue to do the hygiene of washing your hands, sanitizing, and just being safe as you can. Okay, thank you. We are now going to open the floor. Thank you, doctors, for answering the first set of questions. Sean Dickerson is our program specialist who has been monitoring the chat and keeping track of the questions. We are going to ask that we spend the last 30 minutes, if you don't mind, being on the call. We want to take the remainder of the time to allow the audience to ask their questions. So Sean, if you could jump on and give us the first question that has not been answered through the discussion yet.
All right, so then I'll just ask them in the order that we have them here. So going to the top, why is it that some doctors are against the vaccine? I saw a doctor who said in 42 months to 1 year, people will suffer from autoimmune system issues. End of question.
I think I can address that question only because I won't be able to stay for the remaining 30 minutes. So I wanted to make sure that I contribute a little bit more. You know, unfortunately, there's always outliers in every statistic. There's always one person who kind of bucks the system, right? In this case, every now and then you have had physicians who come out saying things that are completely contradictory to all of the evidence and all of the evidence-based medicine and everything that's been published in peer-reviewed journals. What we do know is that the very, very, very few actually board certified accredited physicians who have spoken out against vaccines and other evidence-based things usually have a history of also endorsing a lot of other things that are not consistent with good medicine. So I encourage you to find out more about the source of this doctor who and what they're saying and where they're basing their sources and what science they're basing it on. And if the science that they're basing it on has actually been published by a reputable source, and if it's fact-based, and if it's also backed by other physicians. If the majority of physicians in the entire United States, and in fact in the entire world are, and not just physicians, other scientists are endorsing one thing, it's highly unlikely that one or two fringe doctors are going to be accurate.
Thank you. Next question, Sean.
So continuing along the lines of that Dr. Weaver ended there. So there was a question wrong. Are there any reputable non-governmental sources that I can use to get more information?
Go ahead, Dr. Armstrong.
I can answer that. This is Dr. Little. So I'm not, so I guess the question is that there's a degree of distrust of like things like the CDC or FDA, which are governmental run. So one way to think about it is that all of these vaccines have to come from the individual companies. So Pfizer, Moderna, these are the individual companies that are doing the research, and then it's being reviewed by the FDA. So you can actually go to each of their websites individually. So if you want to skip the government and go to their websites. Most healthcare systems also have their own information links. I don't know if they shared the Kaiser link, but you can also go to Stanford, you can go to Johns Hopkins, you can go to UCSF, COVID, and they will also be having information. So almost every large hospital system will also have a separate web page with multiple links about COVID. I think that when you start getting outside of that, then you get more into opinions, where I think it gets a little fishy. You can also try large newspapers like New York Times, Washington Post, which usually link back to sometimes governmental organizations, but I would start there.
Thank you. Dr. Armstrong, you had a comment?
I just want to add, the Children's Hospital of Pennsylvania has a vaccine education center. And it is, I hope, I sent you that link, Claudia, so I hope you put that in there. It's very, very, very good. It's really, it has a lot of good information on COVID. I used it to prepare for this evening. And it has a lot of information for patients on all kinds of vaccines. Thank you.
Thank you. Yes, please look out in the chat. The resources will be coming from Kiana. She is our student ambassador. So you can look for her name. If you don't see it, message her directly and she can give you the links. Thank you. Next question, Sean.
Okay, so I'll tie these two together here. How do we decide which vaccine is best for us, as there are so many options? And how effective does each COVID vaccine last after a shot?
Hi, Dr. Little. I'm happy to answer it again. So I think the question is, how do you decide? So unfortunately, you may not have a choice. Often, each site only has access to one, usually, which is just based on resource allocation. So sometimes you can call the site before to see which one you're getting. That's a little bit more complicated. Maybe after more time, when there's more distribution, you may have a choice when you go to your vaccine appointment, but I'm not sure that's available everywhere yet. In terms of efficacy of each vaccine, I have the data, but of course I can't see it right now. So we'll send it to Claudia, who can distribute it maybe to the student group at a later point. But the average number is 95% efficacy. There's even studies that in the Black population it was 100% efficacious, and even depending on the certain age group. So we say 94 to 95% is the average, with even higher in certain populations.
Okay. So this question, and forgive me if my internet, I'm getting that message, it's unstable. So if you can't hear me, just please ask again. Question, I work in a hospital and I have a history of becoming very, very sick after flu vaccine. Of course, working in hospitals, nurses and doctors will convince me to take COVID vaccine, but I've been scared to becoming very, very sick. Is it safe?
I think the short answer is that it's very safe. There are rarely any contraindications to getting the vaccines, or like for even people with like allergies to like food and drugs, we were still recommending people to get the COVID vaccine. So I would say that's very safe.
I'd also like to piggyback on that. When you're deciding whether or not to get any vaccine, it's important to weigh the risks and the benefits. If the risk of having a vaccine outweighs any benefit, then obviously you don't want to do it. But in this case, the risk of becoming ill from COVID-19 is so much higher than any risk of getting a little bit sick for a couple of days. I'd much rather get a sore arm or a rash or hives or a headache or whatever than be in the hospital for COVID-19.
Okay. Sorry, continue taking my order here. So if someone has already gotten COVID-19, why is it still suggested that they get vaccinated?
I can take that one. There are variants that are developing. We haven't really talked about the sub variants, and it's thought that if you have one you possibly could get another one. And if you're vaccinated, it can stimulate your immune system to a degree that will help cover those variants. So that's my answer to that.
Okay. And this has come up, I see a couple times here. So, so again, along the lines of the which shot is the safest to take, and then along that lines is why is it that Johnson & Johnson is only 1 dose, but Moderna and Pfizer requires 2 doses? What happens to the body? So I'll let you take that first. Yeah. So why is it that Johnson & Johnson is only 1 dose, Moderna and Pfizer are 2 doses, and which shot is the safest to take? Or is it no takers?
Okay, so the Johnson & Johnson is only 1 dose, I think, just because the company chose to. I don't think there's a real reason, because in terms of efficacy, it is less, right? So it's around 67% versus the 2-shot is considered to be around 95%. I think the idea was to increase access for populations that may not be able to return for a second dose, you know, feel more comfortable, et cetera. It is made a little bit differently too. So I think that it was just in order to provide people with options. That's my general gist of it. Though of course we can probably deep dive on their website or on the FDA like approval page to understand more. In terms of which one is better, Pfizer versus Moderna. I know initially there's the thoughts that Pfizer was better, then sometimes it was Moderna was better. Moderna has more side effects maybe than Pfizer. Honestly, I think the jury is still out. I think they're considered equally effective. Whether you'll have side effects more with one or the other, I think is can't predict. I think it's flipping a coin. So I think you're really safe to get either one, but definitely the Pfizer and Moderna are more effective than the Johnson & Johnson.
Thank you. Sean, let me jump in. Someone sent me an email. For some reason, they couldn't do it on the chat. The question is, as the numbers have now gone down of people dying with COVID, is it necessary to continue to vaccine people if our numbers are still going down?
Absolutely. Absolutely. Well, it's really important to still get the vaccine, right? Because, you know, if people stop, then numbers can go back up and we're right where we started. So very important to still get the vaccine, bottom line.
Thank you. Sean, any other questions?
Can I piggyback on that answer?
Yes.
So the numbers are going down because of the vaccine. The numbers are going down because of the effort that we're pushing so hard to keep people from becoming infected. So the reason why we want so many people to get vaccinated is that we're trying to reach a number called herd immunity, where a certain percentage of the population is immune to COVID-19, thereby protecting everyone else who can't be vaccinated. So if we stop vaccinating everyone, we will never reach herd immunity. And that's one of the most important reasons why the numbers are going to go down.
I just want to add to that. If we don't continue to vaccinate, there could be a very bad variant that comes out that won't be protected by the vaccine, and we could be back at level 1 again. So it's just really important that people understand that.
Sean?
Okay. Yep. So so that question around the mutations and whether it's so there's a question around mutations and whether it's in the long run good to get the first wave of the vaccine. I think you're kind of answering that with the do it now versus waiting till later. So unless you want to say more about that, I believe the answer is yes, get the vaccine sooner rather than later. So the other question is, why do people with pre-existing conditions need to wait to get the vaccine? It should be the same as 65 plus who are at risks, who are at high risk too, yes or no? So why is it that the pre-existing conditions have to wait for the vaccine?
Hi, Dr. Little. So I think that was actually not in terms of being effective for those populations, but in terms of vaccine access. So, now we have a plethora, there's way more production and vaccine like physically available. But initially we did not have that many available. The distribution was poor and was not equal in all different settings. And so they basically didn't have the ability to vaccinate everyone who technically would be eligible. So I think it was kind of, in a sense, a slightly arbitrary cutoff of, health first responders first, then people over 65, then people with these medical conditions, because they just couldn't open everything up at once. So now luckily in California, right, it's available to basically everyone except children. But I think that's the reason why it wasn't available initially, but now it is.
Thank you. Dr. Weaver, I know you are logging off. She is still at work and getting called to the clinic. So thank you. I appreciate you being here. Thank you for dedicating some time to this work. We really do appreciate you and look forward to having more discussions with you. Oh, you're muted. Like you ready to work.
Yeah, it was a pleasure to join you guys all. Please feel free to send messages to Claudia, and I'll try my best to answer any questions that you guys might have. You can also, I work at Kaiser, so if you need to find me, that's where you'll find me there. You guys take care.
Awesome. Take care. Thank you. Bless you. Sean, we'll take the last two questions before we close out.
Okay. So as to mutations, will the amount of people who don't want to get vaccinated be enough for another mutation of the virus? That ties into, I just saw someone post about if 75% of the people get the vaccine, do you think that 25% that don't take it will be safe?
I think it's actually hard to say because they have to look at the data to figure out if it is. It's really hard to say at this point.
And last question, make it a good one. They've all been good.
Well, I'll just add on to Shaquela's comment. I think that if we don't get enough people vaccinated, definitely there is that risk of a variant, of a very bad variant developing. And Claudia, you and I spoke about Brazil. There are a lot of kids sick in Brazil, and that's probably due to a variant. And we just don't want to risk it. So I would just go out and get, I would encourage you, if you're on the fence, find more information and do what you need to do. But I would encourage you to do that.
Okay. Sean, last question.
And then last question, so I said, COVID screened individuals to enter my current hospital that requests the outpatient pharmacy. Many individuals will say, you don't have to screen me, I've been vaccinated, or why do I still have to wear a mask? I've been vaccinated. What are the chances of catching COVID after being vaccinated, and should we still wear the mask after being vaccinated?
Okay, so for the mRNA vaccines like Pfizer, Moderna, the risk of getting an infection at 2 weeks after your first dose, the risk of getting an infection is reduced by 80%. Now, after 2 weeks after the second dose, the risk of getting an infection is reduced by 90%. So very, very, very high.
There is still some risk, and people can get infected, but the good thing about those people who do get infected is they don't end up on a ventilator, and they don't usually die. And so that's Shaquela's right, but even if you get the disease afterwards, and people have gotten the disease afterwards, their life is protected. They're not going to die.
Thank you. I see a hand raised, so we do have a little time. The hand I see is Brittany. I'm going to ask the ambassador to unmute you so you can ask your question.
Hello, everybody. I just like to speak out loud just because that's just who I am. But thank you guys all because you guys have given us such great information. So you say with getting the vaccine, it's less likely if we actually catch COVID that we'll end up sick. Now, for me as a Black woman who comes from a family of very strong males, very strong people who have very strong opinions against the vaccine, a majority of my family members are out, but as for me, I want to gain as much knowledge to be able to share with others and share with the community. So you feel as though if we are taking these steps to get this vaccine, we are then protecting ourselves from, even harsher if we do get any types of variants, correct?
That's my understanding.
And that's mainly one of the things that I really wanted to clear up. And thank you guys for all of your knowledge. I think that it was definitely very, very well spoken and well given.
Thank you, Brittany. We appreciate you. Brittany is one of our dual students from San Jose City and Evergreen. We appreciate you jumping in and participating and getting the knowledge you need. So thank you. Again, I do want to thank our audience. If there was a question that has gone unanswered, we ask that you get in contact with us. We want to make sure that your question does get answered, but due to the respect of time, we're going to wrap up here as we let the doctors close out with their final thoughts. But if you do have a burning question, we ask that you get in touch with our office. Sean Dickerson is our program specialist, and please look in the chat for our direct website where you can email, call, text, and get in contact with us so we can get you the information that you need. At this time, each doctor, if you could just take the floor and give us your closing thoughts, so what you would like our audience to take away from this workshop.
So I'm glad to be a part of this. I say one thing is, do your research, be your own advocate, ask questions, and I do recommend getting the vaccine.
Thank you. Thank you, Dr. Gravy.
Hi, Dr. Little. So again, thank you for inviting me to join. I think even in the process of, coming up to date with information and preparing for this, I even learned more. I'll just briefly tell you about my vaccine experience. So I got the vaccine. I actually didn't have any systemic effects. So that means like headache, body chills. I just had a sore arm after the first shot. But I will say that my arm was so sore that I went to pick up my daughter. I thought I had torn a muscle. I told my husband I need to go to the hospital. I don't know what happened to my arm. And he's like, isn't that the arm that you got the shot in? So I had a very sore arm for 2 days, but it was handled by Motrin, and that was the worst. But again, just like I said in the beginning, you are in charge of your own body. You make your own personal decisions. For me, the right decision was to get the COVID vaccine. I think the data supports that. But at the end of the day, remember it is your body. And that's the most important thing for medicine in general.
Thank you, Dr. Richardson. Dr. Armstrong?
I want to really thank you, Claudia, for putting this together. And I want to thank Dr. Garvey and Dr. Little Richardson and our doctor from Gilroy too, whose name I'm blanking right now.
Dr. Weaver.
Yeah, Dr. Weaver. And yes, I have learned a lot today. And, as a physician, you want the best for your patients, but I agree, you have to feel comfortable and you have to feel safe about your decision. There's a lot of information out there. I'll just say again what several of the doctors said earlier. Try not to use people's, Facebook comments or kind of non-scientific comments to make your decision. And just very, very happy to be part of this group this evening. Thank you so much.
Thank you. Thank you so much. So as we close out, again, the chat is open. We ask you to jump on there. You're welcome to give your shout outs, hellos, and please sign in. I want to thank all the doctors on our panel for partnering up to do this event. This took weeks and weeks and weeks of talking and discussing, and they are busy people. So to get them all present at one time was quite difficult, but we made it happen. And I appreciate the dedication that you guys shared as we all have the same goal here, which is to simply educate our community so that you can take the best decision for yourself and your family. The takeaway I want you guys to get from here that you heard and we've been all saying is advocate for yourself. It is your right. You have the right to ask questions. No question is not a worthy question. It is your right. So please, please ask away. And as you've heard, one of the things Dr. Armstrong mentioned in one of your answers was the ingredients. One of the concerns that has been a discussion with several students that I have had is that there was a tracker or a chip, microchip in the vaccine. So these are things that we're hearing, and we all revolve around social media and Facebook and what we are getting from our phone, what our phones are telling us when you start researching things on Google, the things that you start pulling up in your emails and things. So it is so important, as they've stated, to do your research. And if you need help with that research, that's where you can utilize our services. Our program is here to help you. You don't necessarily need to be a student at Evergreen Valley College to utilize our program. We are a community program. So anyone that's interested in just getting more information, or you just need help with researching or connecting you with some answers, call us, get in touch with us. That is the beauty of this community. So I ask you with that, we're gonna close out, and please take away that if you choose not to get the vaccine, you're okay. Just please continue to use safety precaution. Social distance, wear your mask, wash your hands, sanitize, and keep from really large crowds, because the rest of the population that is choosing to get vaccinated is trying to bring that number down and get us to that, I'm gonna say it wrong, but there was a term, community immunity number.
Herd immunity.
I'm not a doctor. But y'all heard of. Yeah, we want to get to that. We want to get to that community number. So those of you that are going to get vaccine, we say ashe and thank you to our doctors for participating and giving us the knowledge we need to now go forth and make that decision. Please unmute yourself and say hello. We welcome you, Ashe. I saw our president on the line. Thank you for being here. Mama Charlie, I heard you. Students, if you're there, please sign in. Your teachers will be asking for my roster, so make sure you sign in. Hello, Christopher. Thank you for being here. Ashe.
Hi, Christopher.
Hi, Miss Charlie.
Dr. Akila, thank you so much, Dr. Akila, for jumping on and partnering with us. You brought light to our vision of our history and our pain. We really appreciate you bringing that component, and also discussing what our athletes, that is a huge portion of the Black community and Black student is our athletes, and they are faced with this challenge. So
hi, Brittany.
Thank you for having me.
Hi, President Gilkerson.
Oh, President Gilkerson, she got her mask on. I see you.
Thank you, Dr. Akila, also for giving a shout out to the African American Community Service Agency. So I'm one of the community workers there as well. Okay. So I work with Caleb. So it was good
great.
to hear.
Yeah, we were able to speak together on another platform for the community center a few weeks ago. So that was my marathon day. I had a 24-hour.
It's nice to see community kind of come full circle.
Exactly. But like I said, use your platform. If you have it, use your platform to advocate and to stand up and speak up and connect with these amazing
Harvey
resources.
Gibson.
Harvey Gibson, you're being called out. We want to see your face.
Yeah, you will later on in about 6 months, maybe a
Hi,
year with the mask.
Harvey.
Hey, Chris, you got your ed plan together, right? I sent it.
Yeah.
Okay, hey, good seeing you.
Thank you all. With that, we are going to close out. So we appreciate the space. Kiana, if you can hit us back on that mic, you or Sean, with some 1 to the 2s and some exit music. We thank you all for being here. Please don't forget to sign in so we can keep in touch and get you, make sure you get the links that we shared in the chat. We will also be sharing that, and this video will be edited and posted on our website as well. So thank you all for being here. Have a wonderful evening. Stay blessed. Ashe.